excited to be here, and I'm really excited to have been asked to moderate this evening. I think all of us know that any work we do for the Lupus Foundation is a labor of love, and for me, it's really not any different. My connection to lupus is my mother, who's having a flare as we speak. She's going through it, and we know lupus thrivers do just that. They thrive through it. But we want to talk a lot about why we're here. This evening is really just about helping us, save the Lupus Foundation. Your support, your work is more important than it ever has been. We know that any medical conditions or any issues that arise for lupus, for the average person, is doubly impactful for a lupus patient, and whatever is happening in the world happens threefold for our lupus thrivers. And this situation, this pandemic, the COVID situation, is no different. We are feeling the impacts. Our constituents are feeling the impacts. Our families are feeling the impacts. And so we really just wanted to take some time to talk, to tell you what's going on, and really, help you draw the picture for what the Lupus Foundation means to the people that we serve, and let you hear it directly from some of the people that work with us and some of the people that are thriving with lupus. We want you to listen to these stories and really take them to heart, just to understand the impact that we have made and that we can continue to make with your help. So first up, we'll have Dr. Ginger Dickerson. Dr. Dickerson has been involved with the Lupus Foundation for about 15 years. Of course, a familial connection. Her sister has been diagnosed with lupus, and so she became committed to supporting the mission of the LFANC. She, her brother, and their family have founded the Annual Lupus Mardi Gras Gala, which many of you have attended, and it's one of our hallmark events, and a lot goes into doing those events. But from those events comes the fruits of all of our labor, and that's the service to our lupus thrivers. So Dr. Dickerson has also been a former board member, and I'm going to, pass the mic over to Dr. Dickerson so she can share her story and share with you how the LFANC has impacted she and her family. Dr. Dickerson?
Hey, can you guys hear me?
Yep, we can hear you.
Okay, good. We're having a little storm pass through out here, so
Indeed.
I keep getting bumped off my computer, so let me know if I get dropped. Thank you for the introduction. I came here in 98, and my sister, and that was to work. I'm an OBGYN doctor, and my sister had been diagnosed with lupus when I was a third-year medical student, and got pretty sick during the course of her initial diagnosis. And when I moved here to start work in 98, I was getting my feet on the ground, but she unfortunately went into another really intense flare. She had just gotten married, didn't have any kids, and was looking at having to start cytoxane therapy. And honestly, I called the chapter here, and I was just trying to find anybody. I knew medically there were some people in the state that might give us some advice about that in terms of having kids and just what all that meant. And it turned out that had to be initiated pretty quickly, but she did well with it. But after calling and getting that help from the chapter, I realized it was something I really wanted to get involved in. And so I reached out, and at that time, the chapter was pretty small. And honestly, some of the board members were working the office just to keep the chapter afloat. And ultimately, I joined the board and was graciously asked to serve as chair. And during that time, I really gained an understanding of what all the chapter does and the people that it reaches out to. As a physician, I participated in the summit presentations. I also participated in some of the health groups that meet at various areas, and we also expanded our service as we hired a new board chair and really committed to trying to serve the entire state, which I know these guys have been doing with some intense work and have done a tremendous job. I even was fortunate enough one year to accompany them to Washington to advocate for funding for research. Thankfully, my sister's done well and is still doing well. And you guys probably see her and us at the gala. I've probably danced with some of you on the dance floor. Hadn't met you in this fashion, but I tell you, we started that event 15 years ago now, and my brother and I just kind of brainstormed and started it because Mardi Gras was big where we grew up in Mississippi, and it was fun. And that event has grown to a large group of people, and it's in Founders Hall, and the organization of that event is enormous. It's moved a long way from sitting here at the kitchen table addressing invitations to what it is now, and I couldn't be happier. But part of my understanding that I gained as board chair was understanding how the funding of this chapter works. And I know what nonprofit means. I know that money raised goes back into the chapter, but it also means there's not a lot of cash reserve. There's not a lot of fluidity with funding. You really stand on the back of your events where you raise money and create awareness and draw interest and get new people in to support the organization. And I can't imagine what a difficult time it is right now trying to work through the lack of fundraising events. I feel very fortunate that we got the gala in when we did before this hit in March, but that's not enough. And I know that this organization really runs on nuts and bolts and tries to save all their funding that they can for patients and service to the community and to the state. And I just want to do all I can to try to help that remain afloat while we get through these difficult times. And we met a little bit last night and got a little update because we were also talking about what to do with the gala this year. And I think at our best estimate, it's going to have to be pushed out until we're sure that we can safely have the event. I joked that we're ahead of the curve because we asked people to wear masks, but these will be a little different mask maybe. But we're going to reach out as a family to quite a few of our friends and colleagues who have attended the gala over the last 15 years. And many of them received the email from the chapter, but we're going to reach out to them personally as a family and ask them to really try to reach into their pockets and give the chapter some money to try to help the fluidity of the financial support over these next few months as we can hopefully get back to our normal fundraising events. I'm very passionate about what this chapter does, very passionate about lupus awareness, and hope that all of us collectively can figure out how we can help keep this organization working in the best way we can right now, because it would break my heart to see the chapter not functioning as the year moves on. So with that, I'll turn it back to you, Ebony, unless anybody has any other questions or thoughts for me.
Much, Ginger. We appreciate all you've done for the Lupus Foundation and for sharing your time this evening on this most important conversation. To your point about the operations, we are so fortunate to have the CEO and staff that we do. They work tirelessly to make sure that all of the funds that we acquire and take in from donors are, put right back into services for the foundation. And the board is just phenomenal at ensuring that we do the most and get the most out of those dollars. But as you can imagine, and you just heard Dr. Dickerson say, that this is just an unprecedented time, and the services that we offer are just so much more important, and that's why we're here tonight. So I'd like to turn it over to one of our newer board members and her husband, Erin and Mike Holland. Erin is herself a lupus thriver and member of the lupus member of our board, as I said. She has definitely a passion for advocacy and has been a great support to Jenny in assisting with furthering our efforts throughout North Carolina. Erin and Mike, can you hear me? Are you there?
Yep, we're good.
Good. You guys can take it away.
Thanks for having us. Yeah, Mike and I have been really active participants in the Lupus Foundation. I was diagnosed, I first got sick in 2015, but I was actually diagnosed a year later, as is common, right? It takes a while. So I got diagnosed in January of 2016, and I was really, really ill for 4 or 5 years there. And I'm just now coming out of the flare, if you can believe it. It's just, it pretty much changed our entire world. And I actually started attending the support groups, which got me a lot more involved. And that was just a really great asset to me, just to understand what kinds of questions to ask doctors, what kind of symptoms people had, what kind of treatments people used. And then from there, once I really got comfortable and met a lot of these really amazing people, Mike and I actually got a lot more active. So last year we got to participate in the summit. We've done the walk every year. I think we've done 3 years at the gala. And we've really encouraged our friends to get more involved because nobody really knows anything about lupus, right? So the people around us who saw this impact on us have really stepped up and helped us. And that's what we've had a pretty strong walk team for several years. And one thing we really realized is how fortunate we are. I had really good healthcare coverage. So some of my treatments were insanely expensive. And I knew that I was getting some of those treatments because I had good coverage. And we realized that we were in a much more fortunate position than a lot of people who have lupus. So we've kind of made it our mission to step up where we can and make the connections where we can and make sure that these chapters stay funded so that they can stay active and help people where they are.
I think the thing that I underestimated is that there are a lot of people who don't have that same level of healthcare coverage, and I can't imagine, losing 25% of your body weight or not being able to pick up a fork one day or whatever it is that a lupus thriver has to endure, and then not have the assistance from healthcare to fall back on. If you've got just to fight your way through it, I feel for those people, and that's why we're committed to do whatever we can. In fact, I've just been taking notes on what new ideas I could think of throughout the call, and some of those Jenny will probably be calling you tomorrow on, because there's some good stuff that we came up with. So it's a challenge. We're all kind of faced with the overarching COVID challenge, but it doesn't take away from the day-to-day pain and suffering that lupus thrivers have to endure, and we're not going to let them not have a resource to call upon when needed.
Anybody have any questions for us? I mean, I'm certainly happy to talk one-on-one if anybody has questions specific about my lupus journey. And of course, any other fundraising ideas, we're always open to that.
If I could add one thing real quick, one of the things that I think you're going to start hearing the theme of, that lupus is a family event, a family. It affects the entire family. Erin shared to me, I think it was this time last year, that one of her sons wrote his senior paper. Am I saying this correct, Erin?
Yeah.
Will you tell a little bit about that and just how it affects the whole entire family?
Yeah, so our oldest son went away to school when he was 15 and moved up to New England because he plays ice hockey. And so he missed a lot of the drama that was happening at home, because that's when I was really, really starting to suffer. And he came home for, I don't know, it was some break, and I couldn't get upstairs to the bedroom. And so Mike had asked him to kind of carry me up to put me in bed. And that was the paper that he wrote about and had to stand up and read it in front of his senior class. Sorry, I get a little choked up. But
I'm clearing up too with you.
I think he was worried that I was not going to make it. And you don't want your kids to have to see that.
Yeah, I mean, we didn't realize the impact it had on him. But as somebody who's 18 years old, who wasn't living at home at the time of the real worst of the lupus, and you read something like that, and you're just taken by it, and it strikes you. So that's the kind of, and anyone on this call, I mean, I think many of you are touched by lupus in some way. You certainly understand that impact that either you as a lupus thriver or your family members that they're going through. And so it's that fighting spirit that you see impact others around you, and we just can't give up all the good that gets done with this chapter to many that really, really need it. So it's if this is a save, we want to look back on this night and say, not only did we save, but we catapulted this organization to such a place that we're not going to look back again.
Erin, this is Ebony. I have a question for you. With you having had so much success with the walks and your walk teams in the past, talk about, if you can, what challenges you're seeing now and maybe ways that you're working to overcome that for people that are in the same boat, for our team captains that might be here.
So this year I did my May campaign, for Lupus Awareness Month, and I did that on Facebook, and it was not as strong as my previous years because I always supplement it with a big party. That's really where we get people to come in and spend money and do like raffles, and it's usually like at a brewery or something like that where people can really kind of let loose and have some fun with it. And so that's been a real challenge. I did the Facebook portion, and I got about 75% of my goal. I'm going to do another push as we get into that September 12th date. And I was writing down some notes on some things that I could get. Maybe ask my friends, make a donation and send me a picture of you in your purple so I can post it on my Facebook page. And then I can call it out and say, these are my friends, and they just donated $25 or $50 or whatever the thing is. So I'm trying to be a little bit more creative because I think people are looking for something fun to do, but it has to be so easy and very quick. And I think while the virtual stuff has been great, like a lot of my friends are kind of zoomed out. I mean, they're Zooming all day for work, and then they're doing stuff for their kids for school. And, so I want to make it just easy and fun. And I try to looking at other organizations like and things that they've done virtually, like the Humane Society and some of those other organizations, and see what has worked for them.
Thank you so much. It always helps to hear and kind of brainstorm on different ideas. So thank you so much for sharing that. And just thank you for your work, Erin. I know you jumped in with, a lot of innovative ideas, and it's been a great help to the board. And we just appreciate what you and Mike have done for us. Thank you.
Absolutely.
So next we want to turn over to Myrah Lykes. Myrah is also a lupus thriver and support leader for Iredell County. She is always willing to go above and beyond to support the Lupus Foundation. She, can often be seen supporting the foundation staff, volunteerism at our events, and just providing laughter and joy to everyone that she meets. Myrah is here to share her story with you this evening. Myrah?
Hi, everybody. I'm Myrah, and I am a 26-year lupus thriver. I am totally in a flare today, totally. But I still have my smile, and I'm gonna keep.
And you look right pretty. You look pretty. I'm loving the hair, girl.
Gosh, you look gorgeous.
Thank you. My birthday was yesterday, and I got my hair fixed, but I told my husband I wanted to sleep all day. So I slept with my hair like this yesterday all day.
Well, girl, if a flare looks like that, I need one in my life. Good grief.
You look better than a lot of us working from home that haven't had any medical issues.
That's my motto for my lupus thrivers, that I help through their support groups. Life gives life. So when we get together at our group meetings, even if we're sick or not feeling well, just to be together to share our stories and laugh about the fact that we can't walk, or laugh about the fact that our hand hurts or we can't do what we could do a couple of weeks ago. That's what gives us the support and allow us to keep making it. So that being said, I can say that I've been with the Lupus Support Group for about almost 6 years. My journey with lupus, I kind of went by myself for a long while because I was in Virginia. So being hospitalized for 11 months, not being able to walk for 3 years, going back and forth to Duke every Monday to get chemo treatments and going through all of that. When I got here, someone said, you need to call Charlotte, I believe. They have a lupus foundation, and you need to talk to them. And when I called, Allie answered the phone. So Allie was that person that I spoke with, and I just asked questions. I really wasn't going to be that person to come over into it, but Allie invited me to the first walk they had. So I knew of someone who was coming from Virginia to be at that walk. And when I got to the walk, Allie didn't know I was coming or anything. When she heard my voice and my laugh, she said, I remember that laugh on the phone. Are you Myrah? And I was like, yes. And so she said, who are you walking with? So I told her the person I was walking with. It was a girl named Jamaica from Virginia. And I said, I'm on her team. And she's like, how are you on her team? You have 25 people walking with you. I said, well, I mean, they just came to support me. So that's when we get to the table and Sabrina Rose looks at me and said, no, honey, you have your own team. This is going to be your team, and let her have her team. So from there, I've just been pulled into the Lupus Foundation, and I've been a support group leader since. And I can truly say that was a good experience, the walk, but me actually coming into an environment when I came to the first summit. Woo. Wait a minute. When I walked, excuse me. When I walked into the first summit, and to walk in a room with over 300 people that had what I had and could understand me, I hadn't had it the whole 20 years of my life. It was like I had found a family that I didn't know that I had. And so, when I was with my family, to say that my leg or my arm hurt, it's like, take a Tylenol, it's okay. But to tell y'all that my leg or my arm hurt, girl, I know it's down in the bone, like right here. It was like you could really relate to me. And I found a family here. And not only have I found a family here in the lupus community, but that's what we're able to give here at our county, with you all giving us the guidance and giving us the education. And we're not having to always Google things, because when you Google it, it's so broad and you see most of the horror stories. But being able to narrow it down, that you all are able to give us that information that we need to help us make it and go to those steps, that we don't miss what we need in order to go through this journey, and to also know that we're not alone. And the financial support that you give to those who are not fortunate enough to pay to come to summits, or when there's a scholarship available, that they can come, and also still to help them with the walk and encourage us and educate us on how to ask for those monies. So you all have really been a blessing to not just my life, but to those individuals that we touch and we give that support to on a monthly basis in the counties. So I'm sorry, I'm a crybaby. It's fine. But but that's what you all have done for us here for the Lupus Foundation.
so much, Myrah. Many of you all will know the loneliness that can be lupus, the isolation and the skepticism that people have when you say you're hurting. So I can even speak as a family member. My mother, having had lupus, there were times she looked 100% fine, and the next minute she would be in a flare or hurting. And as Jenny talked about earlier, it does impact your whole family. And so, having been someone who's seen it and then also experienced what it can be like to say, hey, wait a minute, you look okay. The education that the Lupus Foundation provided me just as a support, as a family member, is really invaluable. And really it just comes back to being able to help. And that's what we want to continue to do. And so thank you for your work, Myrah. Thank you for your smile. I think I've just met you this evening. We've never actually met, but your smile and your laugh is infectious. So thank you. Thank you so much for being here in the middle of a flare.
Thank you.
So we'll move along, and I want to introduce to you Barry and Elizabeth Alexander. Barry is a newer board member as well. His legal mind is brilliant in helping us navigate through all of the, I don't even know what you call landmines that have gone along and come along out of this whole COVID situation. And, as a board member, we're all doing the best that we can, but I don't know how we would really have gotten through the decision-making process or even navigated just the challenges that we found ourselves in without someone's guidance that has a legal mind like Barry. So to you, Barry, thank you. Your emails are a pleasure to read. Your recommendations are a pleasure to read.
Your dissertations.
And your wife thank you to your wife for lending him to us.
Thank you.
So while Elizabeth and Barry are newer to the Lupus Foundation, they both have just jumped right into support. And so we're going to let them talk a little bit about their story and what the Lupus Foundation means to them.
All right. Hey, guys. I don't really know many, if any. Jenny, I'm familiar with you, but other than that, so hi everybody. Thank you guys so much for being here from the bottom of our heart. I know that we want to thank you guys, because if it wasn't from the kindness of your heart, then we wouldn't be here today. So thank you guys all for that. As Barry tries to look over at my notes, but I want to start on
Elizabeth, it looked like a look of love. That's what it looked like to us.
I might start crying. So
it is. I probably should get the tissues, but
it's okay.
I'll start back on January 29th, 2020. That was a day that when we woke up, I had a surgery scheduled, and we walked out of the hotel into the corridor and met my mom and my aunt, her sister, along with her husband, in the corridor leading from our hotel into the Cleveland Clinic, where I ended up later spending almost a week. And that was just this January, but it seems like the common theme here is kind of the family members and how this affects the family members. And you walk into the Cleveland Clinic and you go from desk to desk. And then finally your name gets called. And when your name gets called, you have to say goodbye. And it's a sad thing. It's a sad thing to have to say goodbye to all of your loved ones, because you're about to go get wheeled back for surgery. And with lupus, it's not that it happens once in your lifetime. It's something that you deal with over and over and over again. I think in the last 4 years that Barry and I have been together, I've had some 8 I think, surgeries or medical procedures where we're going to, that required, that kind of interaction. My son is never there. My son will, and luckily will not participate in any of this. My son is 19. He understands lupus, but doesn't accept lupus. Never has, but just to put it, how it hurts the family so much that he got in a car accident. He flipped his Jeep and he called and right before surgery, just a couple weeks before I had surgery, and said, "Mom, we just gotten ready for bed," and says, "Mom, I need you to come." So what happens? I just got in an accident. And I'm like, "Are you okay?" And says, "Mom, no, it's really bad. Like the Jeep is flipped." And so, of course, I'm like rushing to the scene and thinking, holy shit, I'm about to come up there and I have no idea how my son is. And this is just so scary. And I think like right when I got there, it wasn't right when I got there. It was the next day when I went to him and I was like, "Don't you ever scare me like that." And he was like, "Mom, you scare me like that every single time." And it's like, wow, that's kind of sad. But anyways, we'll circle back to that. I will say that I am now a 29-year survivor of lupus. I got diagnosed, started getting sick when I was a young child, and then testing from Duke Hospital every Friday, down to Charlotte, just all over the place, getting testing, trying to figure out what was wrong, which I know all of us have gone through, right? Which in and of itself was frustrating. And finally, I had surgery, and they did biopsies and came back with the rheumatoid arthritis at first. And then, of course, as we know, when you don't have one autoimmune disease, you have multiple ones. So, of course, it morphs into lupus. And so for 29 years, it's just been battling. I've had my ups and downs. I have my bad days, my good days. Those bad days, is important to be gentle on myself, to remind myself that it's okay. But, and as we also know that with lupus, then also comes other problems. So at the time when I got diagnosed with lupus, I was also battling GYN issues, and from the age of 14 to 24 had, at that point, after my first 45-minute surgery that turned into 4 hours, after that, I think I had 7 more surgeries. Somehow was blessed with my son, which was amazing, but by the age of 24, had an entire total abdominal hysterectomy, which then put me into menopause. So 10 years of menopause. So here we are now, bones as brittle as can be, and lupus flaring up and down, but we're getting there, right? Like we're getting there. We're on the road. Good days, bad days. But it's not a devastating disease. It's a life-altering disease, and it's life-altering for the person that has it, but I do believe that it's more life-altering for those around us. I know that a lot of times as a lupus patient, we feel alone, and we feel like we can't necessarily run to our significant other and tell them about every ache and pain, because damn it, we do it every day, and it's not everybody wants to hear this all the time. But I'm lucky enough to have my wonderful and supportive husband who has been here with me on this latest downslope of health. I feel just my heart breaks for Barry as well, that when he met me 4 years ago, he immediately knew I had lupus, because I was one of those people that, although I was a public defender and I had this state health insurance, it sucks. I couldn't afford to go to my doctors, couldn't afford any medicine, couldn't afford anything. So why bother? You're just kind of left up in the air. And that's how it is. You make too much to qualify for any kind of financial assistance, yet you can't afford to have health care. And I know that a lot of people are in that boat. I think the majority of Americans are in that boat. And I know it's not just with lupus, it's with everything. I know that so many people unnecessarily die because of that. But I will digress on healthcare forever. And I know my husband knows that I will. So circling back to January 29th of 2020 was probably one of the hardest days, I think, in Barry's life. It was yet another difficult day in my life, but the only thing we could do is put a smile on and say, see ya on the other side. And that's what you do every morning. You got to wake up and you got to know that if you're having a bad day, you hope that tomorrow is a better day. If you're having a good day, you hope tomorrow is just as good. And you just take it day by day as much as you can. So, anyways, I know Barry is itching to talk over here, so I'll hand it over to him.
I don't know if I really want to follow you. I think you can probably see why the Lupus Foundation was so important for me to join and commit to. Elizabeth mentioned that I met her. We met a little over 4 years ago, 4.5 years ago, and of course she said to me, "I have lupus," and I'm like, "Well, what is that?" And she looks so healthy, like she looks today, beautiful.
You don't know.
But I began to notice the little things. She'd run out of gas in the afternoon. She'd lay down if she got home. Her fevers would run 99.1, 99.4, like most days.
Constant.
Major stomach infection as a result of a change in lupus medicines, and then 2 trips to the hospital. And so I'm a fixer. And that's what lawyers do. We get problems, we fix them. We don't know anything else. So I do my research and I say, okay, there's cures and medication. You just don't have the right health insurance, okay? So we get married and we pack up the car.
Now I have great health insurance. Like awesome health insurance.
You're welcome. So we pack up the car and we head to Johns Hopkins. And Johns Hopkins has a National Lupus Center. And I remember, it's an incredible place, and I remember as I sat there, I realized, like most of the folks on the call that have lupus or family members, that there actually is no pill. There's just not a single pill that you can take. And it was a sobering day for me, because I came to that realization, and then I've watched Elizabeth bounce between various medications. They're drugs. They all have tremendous side effects. And it's been hard on many days.
One thing after another.
Seeing her in pain and knowing that she's being tough and trying to figure out the best way to support her. In my case, without being the know-it-all for everything, because I learned that it's not a fixable thing. But I will tell you that those are the difficult moments. Because what I have learned over our little journey together is the power of positive thinking and support that keeps me going. I remind myself on days when I'm feeling down that Elizabeth has made it nearly 30 years. And say to myself, well, you can do it another 30 years, and the only question is whether I'll be around for another 30 years. I crawl into bed a little bit earlier at nighttime than I ever did. Trying to find the right way to ask how she's feeling. There are certain days where it's difficult because you can see that on someone's face. I watch the color change in her face, the red. I know that her fever is spiked. I've tried to learn the names of the drugs that many of you take, although I honestly can't remember every single one of them. And I said to her the other day, I said, God forbid we go to the hospital again. I can't have them keep asking, okay, well, do you take this one anymore? Do you take this one? And it's yes, no, yes, but the dosage is different.
And
so
then how many? What are you allergic to? And you're like,
yeah.
Is it? Do I need to go through the list? What's really relevant?
I'll tell you, I assume like many of you that sometimes I feel like many days I'm playing whack-a-mole. But learning to accept that, I think, is fine as long as you keep whacking and don't stop. I for other caregivers, I offer this: you're not alone. You're not. And lupus is a disease that you know that will have ups and downs. And I think I work on learning to take my down moments and recognize that they'll happen, and to take my up moments with Elizabeth and relish them. So really thank you for joining us today. And I don't have much else to say, but Elizabeth probably has more questions to answer if folks have any.
Yeah, we're very open about it. So it's been quite a journey.
I'm going to have my Diet Coke though now.
All the stuff that we're not supposed to have, right? That's going to flare us and all that stuff. So any questions?
No, just thank you very much, guys.
You're welcome. Thanks for having us here.
Thank you guys so much. So as I've listened this evening, one of the things that is just a recurring theme with any lupus patients, we call you all thrivers, and it really is true. We've heard people this evening talk about having had lupus for, 10, 15, 29, 26 years. And I think of my mother who was diagnosed with lupus when she was 35 and was told she would not live to see 40. She is 62 now. And it really is a testament to the spirit of the fight in all of the patients and the families that are working through whatever it is to be lupus. You hear Barry talk about his not wanting to ask how Elizabeth is feeling. I asked my mom, "How are you feeling?" She says, "I'm hurting." I said, "What's wrong?" She says, "I have lupus." And I had to say, "Oh, sorry, Mom, you have lupus." And, I think all of you here today are really a testament to what it looks like to thrive with something that there's no cure for and no cure in sight. And, we just, the members of the board, the staff, all of us, we just thank you so much for being here this evening to share. One of the things that we've all talked about as a board is the fact that so much of our fundraising really depends on the efforts of the very people that we serve. And so, if I could say anything to you all tonight, it really is that so few people actually know that the Lupus Foundation is here. And because lupus is not as glamorous, or maybe glamorous isn't the right word, but isn't as publicized as things like Alzheimer's and breast cancer, we have no idea who actually has lupus. We are walking in circles with people who, unless you have on a t-shirt or unless you happen to just drop the word lupus, you will never know. And I think that's where, we really need support, is getting out the message that we're here to support thrivers, and that we can't do it without the help of people that don't have lupus, the people that, family members that are supporting people with lupus, or, if you got a rich friend, it never hurts to ask, because those are the people that we really need support from. So, I would ask this evening that, ask someone you haven't asked, for their support, because, it's tough for everybody, but people want to help if they just know that there's a need. And so, as we're coming to a close this evening, I want to turn over the floor to our fearless leader, Cherie Pearsall. You all know her. She is the chair of the board and is the definition of thriving, the definition of doing too much, doing for everyone all the time, and doing so with a smile on her face, but at the same time struggling with lupus like many of you. And so I don't think that we could have someone chair the board of this foundation more qualified to speak about the work that we're doing, and also be the face of what it looks like to live with lupus. So, Cherie, take it away, as I know you will.
Good evening, everyone. Can you hear me? Just want to make sure.
Yep,
we got you.
The stories they're awesome. I definitely appreciate everyone's candor, and I appreciate Ebony with such an introduction. I feel like I need some background music to come into the Zoom meeting. But it is awesome to share this evening with everyone and their stories. Thank you, Ginger, for always being there to support. Always thriving and always there and present and in the place to be. Erin and Mike, thank you for joining the team. We appreciate you and you sharing your family story. It's important that we talk about the family piece of it, because lupus is a family disease. Myrah, thank you for showing up in your model attire. I feel like I need on a horse. I feel like I'm underdressed in my lupus t-shirt.
Right.
I don't appreciate that.
Stop it. Stop.
I thought about turning my screen off to go and change clothes and come back. I feel some kind of way about that. Either way, I love you. And thank you for that infectious laugh. It brightens the room.
I love you too.
Barry and Elizabeth, love you too.
Love you.
Glad you all are a part of the family. Barry, the medicines are oxyprozin, Benlysta, mycophenolate, Modafinil, what else we got? Plaquenil, hydroxychloroquine. You need any help, I can help you with the medicines. And Erin, good job on
get to the pain meds.
Right, I didn't get to the pain meds, tramadol. I mean, it's just ridiculous. But and Erin, good job, girl. I'm marrying into insurance. That's how you roll. We all have to have a game plan. But yeah, I mean, what would a town hall be if we didn't have a call to action as it relates to the foundation? We've heard these stories. They are powerful, but there are only 4 of 50,000 in the state of North Carolina alone. And if you look at it nationally, over 1 million thrivers in the United States who all have their various stories about walking with lupus daily. Sometimes not walking with lupus. They can barely get out of the bed. And so they're thriving with lupus. And what would they be in the state of North Carolina without the support and the influence of the Lupus Foundation? COVID-19, that's an unprecedented event. And it has not only ravaged the bodies of people suffering with autoimmune diseases, it has ravaged the finances of the Lupus Foundation, which is a cornerstone in the state of North Carolina when it comes to our thrivers. You've heard the stories. We're a family. We can relate to one another, and our families become families at the walks and at the galas and at just the nightly conversations that we have, the post-meeting conversations. Those things are important to the thrivers and their families so that they don't feel alone. The support groups that we have. The walks, I know they're fundraisers. It's almost a big family reunion. Everyone shows up in their family reunion t-shirt, just happens to have lupus on it, but it's a big family reunion. And we enjoy that time together, even if it's in 100-degree weather, we're going to make a change whenever we're able to walk again. We're walking in the morning. It was hot. But we are a family, and the Lupus Foundation is a big part of that. And so the foundation, we're in trouble. The impact of COVID pandemic has attacked the country. But for small foundations such as the foundation, it has ripped us at the core. We are about $150,000 below our normal fundraising goal for the year. And that's because we've had to cancel, and we were very strategic in that. Absent of any support from the National Foundation, the board and your CEO and the staff made a preemptive strike to protect those that are thriving with lupus by making some very strategic decisions on the front end. We saw what was happening to the country and the world in March and decided that we would in no way put our people in harm's way just to raise money. Even if it had an adverse impact on the organization as a whole, we would figure it out, and we've been figuring it out ever since. Your foundation has been thriving for its thrivers, but we're not going to be able to hold on without life support. And Erin talks about having, Elizabeth talked about having good health care and what it does when you can get the medicine that you need and the treatment that you need. Same thing with the foundation right now. We're on life support, and we're a small foundation, and we've applied for grants, and the CEO and the board have made strategic moves to downsize. We're moving our facility. We found out COVID has taught us that we can work from home and be just as productive. We've always been good stewards of the foundation's money because we want to put the bulk of our money into programs and services, not operations. We want to take care of our thrivers. That is what they need. And sometimes, even if that need is just someone to talk to who understands when something hurts. No judgment here. And so that is what the foundation is about, and we are in need. A valuable resource are our thrivers, and what's more valuable to our thrivers are their support mechanisms. And those support mechanisms we are in need of right now as far as funding. And so whoever you know, have them talk to who they know so that they can invest in the Lupus Foundation. We don't get a rack in the Walmart in October that says Lupus Foundation of America. We don't have that kind of backing. And so a lot of the things we do are grassroots, and we have a very strong but small core of people that work. I don't think anyone works harder than the Lupus Foundation staff. Jenny, I appreciate everything you and Lindsay and Joe do, because without you all, we would not be here to this day. We probably would have sank in March or April, but you all were so forward thinking, and so we appreciate that. And so we can't stress enough that the closing of our physical facility, we have our folks working from home. Lindsay was on the front end of counseling contracts with vendors, getting forgiveness on deposits, having people furlough some of those things until the next year so that when we're able to open up and wrap our arms around each other and hug and kiss and do the things that we like to do and walk hand in hand, we'll be able to do so with no additional damage to our pockets. Even with those measures, we've even put our stuff pretty much in a U-Haul and moved it to an alternate site. We've been on, Jenny, letgo.com, selling stuff. They have been extremely creative in attempting to maintain the lifeblood of our lupus community in the state of North Carolina. And so if you walk away with anything tonight, walk away with a call to action that the time is now. We have a walk coming up. Do what you can. Get on Facebook, your Twitter, your Instagram. Solicit your family members. Lindsay's put a lot of creative ideas in place for us to reward those who donate. If you know folks that we can connect Jenny to, let's do that so that she can do her thing and help the Lupus Foundation raise money so that in 2021, 2022, 2023, please, Lord, let the COVID be over and we open our doors to the public, and we'll be here to do so. Our thrivers need us. I know what it's like. I am a thriver myself. Obviously, from the stories that I've heard, I think I'm a baby thriver. I've only been thriving about 14 years as far as I know. So I'm in the infancy stage, I believe. But nonetheless, as a young person, 38 years old, being diagnosed with lupus was horrific. I'm a very active person. 3-4 sport athlete, member of law enforcement, and I pushed my body to the max. And when I could no longer do that with no explanation, it was heartbreaking. There was nothing, you couldn't explain it. You didn't understand it. And so I know the stories, and I walk around here with aches and pains now. And yes, Ebony, I do too much. But as long as I can do too much, I'm going to do it. Because at some point, I might not be able to do anything. So I'm going to knock it down while I can. Life may not be short, but it can be challenging. And that's okay. And as long as we keep a positive attitude, I learned that from Myrah. I'm going to laugh when I can, smile when I can. I'm giving me some purple hair, Myrah, just so you know. When I grow hair, it's going to be purple. Just so you know. I love you. But again, thank you all for sharing your stories. Reach out to everyone that you know that is in a position to help the foundation. It is struggling. And we are not afraid to admit that, because it's not about us. It is about the 50,000 people we serve in North Carolina and their families, whatever number that amounts to. That's who we want to be here for. And so again, I thank you all for sharing your Thursday night with us, for telling your stories, very personal stories, but very powerful and important stories. It takes a lot to talk about being a thriver, because we know the stigma that comes with it. And most people don't want to be subject to that. It is what it is. I have finally gotten to the point where if I don't feel well, then I don't feel well. You know, I have surgery coming up soon, and I went to my HR and said, how much time do I have? I need to take some time off for surgery. And she said, really? You have 15 months of sick time. Why do you have 15 months of sick time? Because there's a stigma of taking sick time. And so as a lupus thriver, one of the things you'll do is you'll come to work when you should not come to work, because you don't want anybody to think you're lazy or you're tired or you're inept or you're incapable or you're non-functioning or you're not as useful as you used to be. And so you go to work and you push through. And so I'm about to burn up some of these 15 months, just so y'all know, because that is what I have to do to continue to thrive. But in the meantime, the foundation will be there to support me. I guarantee you I'll get phone calls. I'll probably get some care packages, hint, hint. Get my address later. But the foundation will support me in that. And there will be people calling me, and they'll be on Facebook, and they'll be on Messenger. I have a very large thriver group that reaches out to me all the time. And so we need that to be here, and we need it to stay. And so, Jenny, thank you for everything that you've done. Lindsay, thank you for your vision and putting this town hall together. Ebony, thank you for your voice in moderating. Thank you to all the board members, past and present, that are here in support, and all of you that were willing to tell your story in an effort to help the foundation continue to thrive for its thrivers. Thank you.